And thanks for breaking down all those updates for us. We continue to follow developing news from UMass Amherst and promising news in the fight against cancer. As researchers say, they have created a vaccine that effectively prevented several different types of cancer in mice. Western Mass News reporter Addie Patterson is live in studio with more after talking with one of the researchers of this vaccine. Addie, what can you tell us?
Amanda, previous research on the nanoparticle-based drug design showed that it can shrink and clear cancer tumors in mice, but now it's been proven it can also work preventatively. The latest study shows it can prevent melanoma, pancreatic, and triple-negative breast cancer in mice. Here's how it works. The nanoparticle vaccine is paired with melanoma peptides, which teaches the immune system to recognize and attack cancer molecules, similar to how the flu shot typically contains parts of the inactivated flu virus. Nearly all of the vaccinated mice who were tested on remained tumor-free after being exposed to cancerous cells and survived until the study ended at 250 days of completion. In some studies, the vaccine also completely prevented the cancer spread. All of the mice vaccinated with traditional vaccines or the ones who remained completely unvaccinated, however, developed tumors when exposed to cancer cells, and none of them survived longer than 35 days. Western Mass News spoke with scientific researcher and co-founder of the vaccine, Griffin Kane. He tells us while it's believed the vaccine can likely treat different forms of cancer, focusing in on a few specific strains was the most practical and fastest way to make the shot available for patients.
I would love to have spent 6 months or a year essentially just proving it out in every single preclinical cancer model that we can to show that, hey, this works and everything. But ultimately, that's not the right pathway to get it into the clinic and into patients as quick as possible. The best thing to do is to dial in on a specific patient subset and say, hey, this is what we're going after first. Pursue FDA clearance, and then ultimately branch out into some other cancers, which absolutely, we think that the system has the potential to do that.
Kane tells Western Mass News he believes the initial launch of the vaccine will be a therapeutic approach, treating patients who already have tumors as the best way to get the vaccine to folks as quickly as possible. However, even with a therapeutic approach, Kane tells us it still will take years for the vaccine to be approved for humans. Reporting live in studio, Addie Patterson, Western Mass News.